Hajama 1. Introduction. Hydrocephalus is a common neurosurgical condition in which cerebrospinal fluid, CSF, abnormally accumulates in the ventricles of the brain. Normally, CSF cushions the brain, maintains intracranial pressure, removes waste products, and provides nutrients. Any disruption in production, circulation, or absorption of CSF leads to a pathologic increase in CSF volume and pressure. In infants, it leads to head enlargement because cranial sutures are not yet fused. In children and adults, the rigid skull prevents expansion, so intracranial pressure rises quickly, leading to neurological deterioration. Advances in neurosurgery, particularly the use of ventriculoperitoneal (VP), shunts, and endoscopic third ventriculostomy (ETV), have significantly improved outcomes. Definition: hydrocephalus is defined as, open quote, a condition characterized by excessive accumulation of cerebrospinal fluid, CSF, within the cerebral ventricles, subarachnoid space, or both, resulting in ventricular dilation, raised intracranial pressure, and compression of surrounding brain tissues. Close quote. 3. Etymology. The word hydrocephalus comes from Greek, hydro equals water, kephal equals head. Literally means water in the head. Historically, it was called dropsy of the brain. 4. Epidemiology. Prevalence 1 to 2 cases per 1,000 live births worldwide. Congenital hydrocephalus accounts for 0.5.8 cases per 1,000 births. Normal pressure hydrocephalus, NPH, prevalence in elderly is 0.5 to 3% in people 65 years. Higher rates are reported in low-income countries due to high incidence of neonatal meningitis and poor access to neurosurgical care. No strong sex predilection, although some studies note slightly higher occurrence in males. Mortality and morbidity are strongly related to early diagnosis and surgical intervention. 5. Types 1. Congenital hydrocephalus, present at birth due to malformations. 2. Acquired hydrocephalus, develops later due to trauma, infection, tumor, hemorrhage. 3. Communicating hydrocephalus, impaired CSF absorption and arachnoid granulations, flow within ventricles is intact. 4. Non-communicating, obstructive hydrocephalus, physical obstruction of CSF pathways, e.g. aqueductal stenosis, tumor. 5. Normal pressure hydrocephalus, NPH, enlarged ventricles without significant rise in CSF pressure, mainly in elderly, associated with triad, gait disturbance, dementia, urinary incontinence. 6. Hydrocephalus ex vacuo, ventricular enlargement secondary to brain tissue atrophy, e.g. Alzheimer's disease, not due to true CSF accumulation. 6. Causes. Congenital causes, aqueductal stenosis, narrowing of cerebral aqueduct, neural tube defects, spina bifida, myelomeningocele, Chiari malformation, Dandy-Walker malformation, genetic syndromes, e.g. X-linked hydrocephalus. Acquired causes, intraventricular hemorrhage, common in premature infants. Meningitis, encephalitis, causing scarring of arachnoid granulations. Brain tumors, posterior fossa tumors blocking CSF flow. Head trauma, subarachnoid hemorrhage, post-traumatic fibrosis, post-neurosurgical complications. 7. Risk factors, prematurity, risk of IVH, family history of congenital hydrocephalus, maternal infections during pregnancy, toxoplasmosis, CMV, rubella, neural tube defects linked to folic acid deficiency in pregnancy. CNS tumors or space-occupying lesions, severe head injury, previous meningitis or subarachnoid hemorrhage, advanced maternal age. 8. Complications. If untreated, hydrocephalus can lead to developmental delay and intellectual disability, seizures, blindness, optic nerve atrophy due to papilledema, motor impairment, spasticity, paralysis, poor coordination, endocrine dysfunction due to hypothalamic pituitary compression, behavioral and learning difficulties, shunt complications, infection, blockage, overdrainage, death in severe untreated cases. 9. Pathophysiology 1. CSF production, primarily in the choroid plexus of the ventricles, 500 milliliters per day. 2. CSF circulation, lateral ventricles, foramen of Monro, third ventricle, aqueduct of Sylvius, fourth ventricle, subarachnoid space. 3. CSF absorption via arachnoid villi into venous sinuses. In hydrocephalus, overproduction of CSF, rare, e.g. choroid plexus papilloma. Obstruction, tumor, stenosis, hemorrhage, congenital malformation. Reduced absorption, meningitis, subarachnoid hemorrhage. This results in ventricular dilation, raised intracranial pressure, and progressive compression of white and gray matter, leading to neurological deficits. 10. Signs and symptoms. In infants, abnormal rapid head enlargement, bulging tense fontanelle, thin scalp with visible veins, sunsetting sign, downward deviation of eyes, irritability, vomiting, poor feeding, seizures. In children, morning headaches, nausea and vomiting, vision problems, diplopia, papilledema, irritability, cognitive decline, poor coordination or gait instability. In adults, headache, nausea, vomiting, blurred or double vision, cognitive impairment, confusion, difficulty walking, balance problems, urinary incontinence, NPH. Number 11. Medical diagnosis, history and physical examination, head circumference, neurological exam. Imaging, cranial ultrasound, infants. CT scan shows dilated ventricles, possible obstruction. MRI, gold standard for detecting obstructive lesions. Lumbar puncture measures CSF pressure, contraindicated in high ICP. Neuropsychological tests in suspected NPH. Number 12, nursing diagnosis. Increased intracranial pressure related to CSF accumulation, risk for infection related to shunt insertion, impaired physical mobility due to neuromuscular dysfunction, delayed growth and development in pediatric cases, disturbed body image, children with enlarged head, caregiver role strain related to chronic illness care. Number 13, medical management, temporary measures. Acetazolamide or furosemide, reduce CSF production, limited use. Serial lumbar punctures in neonates with post-hemorrhagic hydrocephalus. Definitive treatment, shunt surgery, ventriculoperitoneal, VP, ventriculoatrial, or ventriculopleural shunt. Endoscopic third ventriculostomy, ETV, creates a bypass hole in the floor of the third ventricle. ETV plus choroid plexus cauterization in infants. Number 14, nursing management. Monitor neurological status, level of consciousness, pupillary response. Measure head circumference daily in infants. Monitor vital signs and signs of increased ICP. Position child with head elevated 30 degrees to promote CSF drainage. Provide postoperative care. Monitor shunt site, prevent infection. Teach family about signs of shunt malfunction, vomiting, headache, drowsiness, fever. Support developmental needs with physiotherapy, occupational therapy. Number 15, treatment options. 1. Shunt procedures, VP shunt, most common, VA shunt, VPL shunt. 2. Endoscopic procedures, ETV, ETV CPC. 3. Pharmacological therapy, temporary. 4. Supportive therapies, physiotherapy, speech therapy, occupational therapy. Number 16. Psychosocial interventions. Counseling for parents and family regarding prognosis. Support groups for families dealing with congenital hydrocephalus. School-based interventions for children with learning disabilities. Encouraging independence in adults with chronic hydrocephalus. Addressing stigma and promoting social integration. Number 17. Prevention. Antenatal care. Folic acid supplementation to prevent neural tube defects. Screening for congenital malformations via prenatal ultrasound. Prevent maternal infections, vaccinations, hygiene. Prevent prematurity and manage neonatal hemorrhage. Prompt treatment of meningitis and CNS infections. Injury prevention measures, helmets, seatbelts to avoid head trauma. Number 18. Conclusion. Hydrocephalus is a life-threatening yet treatable neurological condition caused by CSF accumulation. Early recognition, accurate diagnosis, and timely surgical management significantly improve prognosis. Nurses play a vital role in monitoring, postoperative care, and caregiver education. Alongside medical and nursing interventions, psychosocial support and preventive measures are essential to reduce morbidity and improve quality of life. Thank you. Have a nice day.